Could you tell me a little bit about yourself and your injury?
Yes, my name is Corrine. I'm 35 years old, and I've been in law enforcement for the past 13 years. And I was very excited and honored that this summer of 2014 that I was asked to participate as a dancer in a Pittsburgh version of Dancing with the Stars competition, in which I would be paired up with a professional dancer and perform a ballroom dance routine. And as a former gymnast and a former dancer, I was excited that I would be able to showcase my skills in this dance competition. And a few weeks prior to my very first practice for this event, I was at the beach and I did a gymnastics trick, and then I jumped into a split. And as soon as I jumped into the split, I immediately felt my hamstring tear.
That's awful. What else were your other symptoms when you started your care? Like, other than your hamstring, like, what was bothering you?
Approximately 4 days after the injury, I noticed that there was a very large, long, deep and dark bruise that was all the way down the back of my hamstring, and at that point I knew that something was wrong. Immediately after the injury, I had difficulty walking. I had lost most of the flexibility in my leg. Doing simple everyday tasks such as walking up and down steps was extremely painful.
So you couldn't really dance then?
No. And a few days after the injury, I had sought treatment with my physical therapist, and he did an evaluation on me, and he told me that there was absolutely no way that I would be able to participate in the dance competition in October.
What treatments, doctors, and drugs have you tried that did not help?
At first, I used anti-inflammatory over-the-counter pain medication, topical menthol pain-relieving gels. I wore a thigh brace and compression shorts every single day, and I even went out and bought my own electronic stimulation therapy machine that I wore on my belt.
During your treatment here at Scott Medical, what has improved during your care by using PRP?
Immediately following the PRP, within the week after I received the injection, I noticed rapid and drastic results. I had gained a lot of the flexibility back in my leg. I was able to perform stretches and exercises that I had not been able to do immediately following the injury. Walking and sitting was no longer painful for me. And within 2 weeks after receiving the PRP injection, I was able to start doing gymnastics again.
That's great. Would you recommend this treatment to someone you know, and why or why not?
Yes, I would absolutely recommend the PRP injection to anyone. It is very quick, it's essentially painless, and for me it made the impossible possible, and I was able to dance again.